we are seeing a lot of increase in awareness for cosmetic surgery, and naturally, cosmetic surgery tourism. People going overseas, a lot of people are a lot more aware about it. And naturally, in Australia, our demographics, there's a lot of people going to Thailand or even Indonesia and other places. I mean, regardless of where you go, it's international and not within Australia. Now, my approach here is quite straightforward, and I'm honest about it. Some of my colleagues might disagree, and everyone says, oh, you shouldn't. Some of their work is not too bad, but that is not the issue. Some of the surgeries that they do is, I've seen a lot of patients that have come back and they've seen us for something else, and that's not. The issue is not the results, the issue is safety. It's when things don't go right. Okay? Now you can be lucky and go overseas and, in some country where you might think that, you're going to have issues with health and stuff and might get away with it, that's fine. But when things do go wrong, that's when things really go wrong. And that is, regardless of cosmetic surgery, regardless even if it's orthopedic surgery or whatever it is, a lot of it that is being done in Europe and stuff. If you are going to get surgery, my advice would be to be in the proximity of your surgeon, be there locally. So there is no one, there might be world experts, but if your surgeon's done the surgery, he knows exactly what he's done. So if things go wrong, he has a better understanding of how to go and fix it. So it's not when things go right, it's when things go wrong. Okay, and if they do, it is your body, and it's going to have repercussions and effects. And I have seen that a lot of patients that have come over that have had issues from overseas. And the other aspect that worries me about the overseas, cosmetic surgery in particular, is that unfortunately, majority of the places or the patients that I've seen, you're a number. So at the end of the day, they're not liable. So if things go wrong, what can you do really? Nothing. I mean, you can just contact them and they can just say, okay, we'll give you that. At the end of the day, they just go, it's your body, we told you what the complications are, here's a form that you signed. Okay. And then unfortunately, because you've taken that step, when you come back here, it's much harder to fix stuff rather than getting it right the first time. So it's going to cost you 3 times as much. Anyone that's going to fix it here will unfortunately inherently have this attitude of, well, we told you so. Okay, and that sympathy factor goes. So it's a very, very tough situation. I have seen women who have come in who have gone through that very scarred. So it is a risk, but again, we take risk every day, but is it a risk worth taking over your body and for procedures such as this?